key to strengthening pharmacovigilance, ensuring safer, informed medicine use. And so in studio, we have Pharmacovigilance Manager Lebogang Koitsiwe and Director Dr. Patasarti Gurmurti, representing BOMRA, of course, to explain why medicine safety is everyone's responsibility. Gentlemen, welcome to the Daybreak and good morning.
Good morning, Kay.
Morning. Good morning to all the viewers as well.
Most definitely. All right, let's just start with why medicine safety is such a critical issue in Botswana today. What is the importance of medicine safety, and also what are we seeing in Botswana present day today? We can start with you, Dr. P.
Good morning once again. Medicine safety is a very important issue, not only for Botswana, but as globally. Because as we are all aware, medicines are most widely used intervention, therapeutic intervention, to ensure that a lot of our disease conditions are treated in the patient. And these medicines are intended for doing good, but at times it may also cause some harm. And that harm is what we call as side effects or that adverse effects. So in order to understand this, which type of patients are at risk and how do we minimize that risk? So we need to monitor the safety of medicines in our population. So that's how WHO International Drug Monitoring Program, which you said Uppsala Monitoring Center, has been working with 145 countries around the globe, monitoring the safety of the medicines and bringing them all together as one database, trying to identify the safety concerns in different parts of the world. It becomes more important for Botswana as a country for the reasons that we will not be able to depend completely on the data from the other part of the world, because as a population we are different. It could be the healthcare practices are different, healthcare delivery is different, and also the genetic makeup and our cultural and other differences could also contribute to the safety of the medicines. So that's the reason why BOMRA is building the Botswana National Pharmacovigilance Program, which has got our own national database. And that database is going to help us in understanding how our population is behaving to certain medications in this part of the world, in Botswana, and then identify the safety signals in a very early stage, and take an appropriate regulatory decisions to minimize the risk for any patients who are involved in that. So that's how we have been campaigning around the country. And this week, as a part of the Med Safety Week, we have intensified those campaigns as well.
All right.
Thank you.
Thank you so much. I think as we go on with our conversation, we'll get to the Med Safety Week. Before then, let's talk about the misconceptions, Mr. Koitsiwe, that the public has about side effects and, of course, ultimately reporting any adverse effects of medicine. But when it comes to misconceptions, what are those that we are seeing prevalent in our communities today?
Okay, thank you, Kay, and once again, good morning to Botswana at home. I think most importantly, what we should note is that medicines, like Dr. Pata said, can do both harm and good. And in our culture, most of the time, as we grew up, we understood that when you take a medicine and you get a side effect, sometimes we think it's when the actual drug is working and that it's taking the disease out, you know. You'd get a rash and you think, back home they'll say, "Nya, how that's a misconception. So what we need to really do is that whenever you take any type of medication, be it traditional, be it orthodox, the one that you get from the hospital, if you have any discomfort after taking it, you should report it. Report it to your nearest healthcare provider in Botswana. They will then be able to complete the forms and give the information to BOMRA. We would then be able to look at the information and then see what can be done to prevent this from happening in the future. So those are some of the misconceptions that we have seen in Botswana, and that people think that when you've got a side effect, that's when the product is actually working. But generally, since the establishment of BOMRA and the pharmacovigilance unit, we have seen some form of improvement in terms of reporting of adverse drug reactions. But we know that there's still a lot that needs to be done. And that's why it is very important that for this week, where we are celebrating Med Safety Week, we encourage all stakeholders, including the patients at home and the caregivers, leaders in the community to join us and spread the message of medicine safety.
All right, whilst we're still there, because you mentioned something there, you said even traditional medicine. So I'd like to know your borders as the pharmacovigilance unit or department within BOMRA. Which of these reports do you receive? Do you receive reports from somebody who has consulted a traditional doctor, from somebody who went to the private hospital, to the public hospital? Which ones do you take a look at or manage?
Thank you very much for that question again. We've got several reporting platforms. Okay. This includes those who are techno-savvy, the use of the MedSafety app. Those who are not as techno-savvy as such, they can go to the nearest hospital and report using the 11 paper forms. Now, in terms of what reaction do we actually look into, all type of reactions we really look into. It is very important that people understand that medicines do have side effects and that we need to know about them to improve their safety. So any type of reaction really can and should be reported to BOMRA. This would ensure that, for instance, with traditional medicines where we don't have a lot of information, we can at least start categorizing them and understand them better for future use. So it is important that we receive and we collect everything that has to do with medicines. And especially that in Botswana we know that people will use both traditional medicines and orthodox medicines.
Right.
Okay, if I could just add on to what Mpho has just mentioned. People may tend to have the habit of taking the allopathic medications, that is our English medicines or whatever we call it as, and then also on the side they may also take the traditional medicines. Hoping that they are two different stream of medications and they don't interact or they don't. But unfortunately, even the traditional medicines, they are herbs they're coming from. They would also interact with our body system, and then can influence the outcome of the medications that you are taking, maybe for hypertension or maybe for your diabetes, and it may be for good or it may be for bad. So it's very important, for the public and also to the doctor, healthcare professionals to understand when a patient reports that, okay, I'm not being so good after taking this medication, to take a good history of the medications and also ask them, do you take anything else? Sometimes people take complementary medicines, which you can supplements or food supplements. Or it could also be the traditional medicines. And they could be influencing the outcome of this. So that is a very important point, as Mpho said. If you report anything and everything that you observe as a discomfort, and then we will be able to understand, yes, if you take this diabetic medication with this traditional medicine, there is a danger of something. This particular reaction is most likely to occur. That's a risk identification. Then we can go to the doctors and then we say that, okay, we need to minimize this by this particular risk minimization plans. So reporting anything and everything is very, very important. Yeah.
Most definitely. Thank you so much for also outlining the steps needed for somebody to go and do that reporting. Maybe we can then speak then to what has happened with BOMRA, or what you have noticed over the years ever since the formulation of BOMRA, or the pharmacovigilance department especially. Have you seen improvement in terms of reporting? Have you seen growth in that area? Have you seen more numbers coming in? Are you seeing Botswana becoming more aware that there is a platform such as this one and that can be used? And in that regard, when it comes to addressing these reports or attending to these adverse reactions, what are the challenges you also come across there?
Yeah, thank you for that again, and a very interesting question. Let's start quickly to answer. BOMRA started campaigning and engaging from 2019. But Botswana has been a member of this WHO International Drug Monitoring Program from 2009. But we haven't had much of a progress because it was previously a very small unit called Drug Regulatory Unit, which was doing the functions of the BOMRA. But BOMRA as an autonomous body established only in the later part of 2018, but fully functional from 2019.
Right.
So we started at around 38 reactions in the whole database, what Botswana has contributed. But in the last 6 years, now our database has got more than 11,000 adverse drug reactions, both for medicines and also adverse events for vaccines, which is in the global database. That is the contribution of BOMRA. What I'm trying to say is we're starting from such a 2-digit 3038 for 10 years, But we have done in 6 years, we have almost taken it to 5 digits. So that reflects our Bumra's engagement with the healthcare professionals, continuous education and engagement and doing that. So to give you a benchmark of it, where Bumra is at, World Health Organization says that for 1 million population, there should be a minimum of 200 reports. Then it says there is a functional system in the country.
Right.
But today, as of today, we are at 640 or 637 reports per million population. So that means we are 3 times more than what WHO expects. And that has been possible with as much as our Bumra's efforts as active engaging. But credit goes to all the healthcare professionals, who have taken that more responsibility, and they have been reporting very well to Bumra through different reporting platforms, as Mpho was telling, web-based e-reporting and smartphone-based, and also through the MedSafety app, plus our forms, printed forms. But having said that, there is still more happening on the ground. We may still missing some of those reactions. So it's important all the healthcare professionals keep their eyes and ears open and report every reaction to Bumra.
All right. I trust that as you give us those figures, it's also a reflection of something else. Maybe could be a conversation for another day to say if we're having so many reactions, like you said, 3 times more than what the WHO expects, then it probably reflects something on the medicines that Botswana are receiving, and maybe some type of response needed also at your professional level. But we'll give it some other time, I believe. But today, let's talk about the med safety.
Okay, I'm sorry, you have opened up a very different topic. It has got nothing to do with the medicines that is coming to Botswana.
All right.
Every part of the world, any medication that is taken by the patient certainly will have an adverse outcome. But what doesn't happen is the people on the ground who are treating the patients, they are not keeping their eyes and ears open to identify those reactions. Even if they identify, they don't document in the medical records. Even if they document, they don't report to the regulators. But what is the best part in Botswana is our healthcare professionals are so sweet. They are taking the responsibility to report it to the regulators. That's why we have more reactions. And it has got nothing to do with the quality or the safety of the medicines that we have. This is only helping us to identify any safety signals in our population. So be rest assured, Bumra stands mandate is to assure that all medicines are made available is of prescribed quality, safety and efficacy. So we do follow that, and all medications made available do conform to those standards. Hope I have clarified.
You have clarified. Thank you so much for the clarification. All right, Mr. Koizue, let's get more into now the Med Safety Week, what it is and why Bumra is participating, what it means to your organization.
Thank you very much. What is Med Safety Week? I'd say this is a week that is specifically dedicated to enhancing awareness on medicine safety. And like Dr. Pata said, it is being driven by the Uppsala Monitoring Center, all the way from Sweden. And really our main purpose this week is to really encourage all stakeholders to report medicines, issues around medicines, and because that would then keep everybody safe. It is very much aligned to Bumra's mandate, of course, which is to ensure that all medicines and medical products used in the country meet the set criteria for safety, efficacy, and quality. So we are very much aligned, and this is what we are doing this week, where we want to engage all stakeholders, the media houses, the patients, healthcare professionals, to ensure that they are alive to the fact that all medicines come with some form of side effects, and that these side effects should be reported to Bumra, so that we can ensure that the safety of the medicines is what is supposed to be. That is, we ensure that the risk-benefit balance remains positive when we look into such things.
All right, thank you so much. We're nearing the end of our conversation, Dr. P. Maybe we can then talk to Botswana's involvement in the global campaign and how it benefits our local healthcare, how it benefits our local healthcare industry, and really which platforms or activities you have in place this week that Botswana can be alive to, like he has already said that you're going to be commemorating it throughout the week. What is it that's going to be done, and how can Botswana come through to participate? What is it it, what is your expectation of your stakeholders?
Thank you. Thank you for that question, Kay. See, as we said, we are starting with this wonderful first program is addressing the nation about Mid-Safety Week. But we have lined up so many things on a very daily basis. We are on the print media, we are on the radio, we are on the electronic medias like this. Plus, we are also going around the country, engaging in conducting trainings and workshops once again to our reporting tools. Plus, we are also launching an adverse drug reaction monitoring center in Sidileha Hospital, private. We are doing the private-public partnership. So this is the third private hospital where we have been establishing a adverse drug reaction monitoring center. So that becomes a nodal center for our communication with the hospital for basically any safety-related matter. So like that, we have already established 12 across the country, including many government hospitals, referral hospitals. Now this is the 13th one which we are going to do it today. So plus we are also commemorating this in Mpho on Thursday and Friday. Apart from that, we are doing everything in the other part of the country.
Right.
We will be having a more like a closing ceremony or closing events and more on Thursdays and Fridays. We are going to do public engagements. We have doing the mall events in the mall in Mpho. So we are addressing the public, we are educating them, we are engaging them on reporting of adverse drug reactions. So we are also on our social media platforms, on our X and our Facebook, and so that people can participate and react to that as well. Thank you.
All right, let me thank you so much for your time this morning, and definitely for considering to coming to our studio first as you start your week. Thank you so much.
Thank you. Thank you for having us.
All right.
Have a good day to all the viewers as well.
Of course. That is the Pharmacovigilance Department from Bomra, and we're talking this week's Med Safety Week. It is commemorated globally, and so even as Botswana, we're participating and partaking in that, learning and also going out there to go and do more for our nation.
Today we take a major step in transforming teaching into a fully recognized profession, much like medicine, law, engineering, nursing, to mention but a few. I therefore call upon all teachers to embrace this transformation by registering, keeping their licenses up to date, and to view this as a part of their professional journey and